and here to discuss what is at stake for parents and their newborns in terms of privacy, the president of the Citizens Council for Health Reform, Twila Brase. Twila is Skyping in from Minnesota this morning. So as you join us from St. Paul, Twila, we thank you very much. Give us the lowdown. What's the problem with this reauthorization bill?
Well, we at Citizens Council for Health Freedom are concerned about the fact that the states are getting $99.5 million, and yet the federal government is not requiring states to get parental consent before they store, use, analyze, or share the DNA and the genetic test results of newborns. So what you may or may not realize is that newborn screening happens within the first 24 to 48 hours for every baby born in this country. And several, maybe 2 decades ago, some states decided it would be a good idea to keep those blood spots from the babies because of the DNA. And so there are probably about 17 states around the country that keep all or part of the DNA indefinitely. In other words, forever. And we think that if the federal government is going to fund these programs with our tax dollars, the federal government should at least require them to get parental consent before they store, use, share, or analyze this DNA.
Now, Twila, what is this DNA used for? And my understanding is it's not anonymous, so they actually have a record of you from birth on throughout your life as far as your medical history.
Well, I think it's really important to understand that DNA can never be anonymized. So they can take off the identification information, but as some studies have already proven, and as even federal officials have admitted, DNA cannot be anonymized. And so it's not good enough to take off the identifying information from the blood spot and say, we've protected the child. You haven't protected the child, but above and beyond that, it could be that the research that you're doing is objectionable to the parents of the child, and eventually the child when they grow up, because every baby does become an adult, a voting adult. And so even if they say it's anonymized, that's for us, that's like an excuse to be able to share what isn't theirs, to keep what isn't theirs, to share what isn't theirs without the parents' consent.
Twila, about 1:30 remains. You mentioned some of the research, some of the studies. What would this DNA information be used for conceivably?
Sure. So it can be used for several things. Right now, they're really wanting to use it for research. They're wanting to expand the newborn screening program. And in fact, the federal government has given $25 million to 4 different institutions to develop genomic sequencing for newborn screening. And genomic sequencing is within 2 days of your birth, your entire DNA would be analyzed, laid out, and put in a record. To sequence your DNA is to know all the details of your genetic profile or your genetic blueprint. And that's the direction they're moving, and they would like to use the DNA of babies to move in that direction. But there's also law enforcement who would like to perhaps get their hands on this if this becomes a nationwide DNA repository. Every citizen born, every citizen's DNA held. There are other things like cloning. We don't know all the things that they could choose to use our DNA for. They could get into the middle of paternity cases or into the middle of marriages. If this person marries that person.
Twila, it is a veritable Pandora's box. We appreciate you tipping us off on this, Twila Brase, on this whole issue of privacy for the parents and, more significantly, the newborns. We'll see if the Senate can stop the reauthorization. America's Forum will continue following this time out.